This video's aim is to help if you are suffering with trochanteric bursitis. Anatomy of the hip joint. Ball and socket joint between the femur and pelvis. Surrounded by ligaments and muscles. Has a cartilage labrum around the rim to deepen the socket. There is a hyaline cartilage lining the joint. Bursa over the greater trochanter to reduce friction. Pain is felt directly over the greater trochanter. However, just because pain is here doesn't mean that it is bursitis. Other common reasons for pain here are minor tears or damage to the nearby muscles, tendons or fascia, as well as referred pain from other joints. It is more common in women than men. It most often occurs in people who are age 50 or over. However, it can also occur in younger people, especially in runners. Causes: an injury such as a fall onto the side of your hip area, repetitive movement involving your hip area such as excessive running or walking, prolonged or excessive pressure to the hip area, for example sitting in bucket car seats. Some infections and some diseases can be associated with an inflamed bursa. The presence of surgical wire, implants or scar tissue to the hip area, or having a leg length difference. Symptoms include pain on the outer side of your hip and thigh. A deep ache and burning sensation are common, and pain tends to linger often into the night. It can be painful to walk and certainly run. Diagnosis can be made by your physiotherapist and rarely needs further investigations. Stretches and exercises can help along with anti-inflammatories. Applying ice over the area for 20 minutes in a damp tea towel will help to reduce the inflammation. You will need to avoid aggravating activities such as running. In some cases, the bursa may need a steroid injection. Exercises. The flexibility exercises should be pushed into discomfort while performing them, but should generally make you feel better and looser afterwards. The strengthening exercises should be pain-free or should not increase your pain during or after. If you get worsening symptoms or are unsure, then initially reduce the push into discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. Flexibility exercises. The first exercise is single knee hugging. Lying on your back, bring one knee up towards your chest, grab your knee and pull it so you feel a stretch. Hold for 20 seconds. Now swap and repeat with the opposite leg. Next is bilateral knee hugging. Lying on your back, bring both of your knees up towards your chest, grab your knees and pull them so you feel a stretch. Hold for 20 seconds. Next, extensions in line. Lying on your front in a press-up position. Use your arms to push up so that your lower back arches and your pelvis remains on the ground. Go as far as possible and hold for 20 seconds, then lower back down. Glute stretches. Lying on your back, bring your right knee up towards your left shoulder with your right hand on your knee. Maintaining this position, take hold of your right ankle with your left hand and pull it round toward your head. Hold for 20 seconds, now swap and repeat with the left leg. Strengthening exercises. The next exercise is glute strengthening, the Clam. Lying on your side, feet together, knees and hips bent, and knees together. Slowly lift your top knee off the bottom one as far as you can, but being careful not to roll your body back. Lower back down and then repeat 15 times or till fatigue, then change and do the other leg. The next exercise is bridging. Lying on your back, put your feet flat on the floor with your knees bent to 90 degrees. Lift your bottom off the ground till you're straight and lower back down. Hold at the top for 5 seconds and repeat 5 times or till fatigue. The next exercise is knee pivots. Lying on your side, feet together, knees and hips bent, and knees together. Slowly lift your top leg off the bottom one. Now the aim is to keep the knee of your upper leg in the same point in the air so that you pivot around it. Next, lift your heel up towards the ceiling. Now lower the heel down as far as you can, maintaining the same knee placement in the air and without rolling your body back. Repeat 15 times or till fatigue on this side, then swap and repeat for the opposite leg. The next exercise is heel pivots. Lying on your side, feet together, knees and hips bent, and knees together. Slowly lift your top leg off the bottom one. Now the aim is to keep the heel of your upper leg in the same spot in the air so that you pivot around it. Next, lift your knee up towards the ceiling without rolling back with your body. Now lower the knee down as far as you can, maintaining the same heel placement in the air. Repeat 15 times or till fatigue on this side, then swap and repeat with the opposite leg.